Hello, I'm Nicholas Atkins, and the past semester I have been a clinical intern at TriStar Hendersonville Medical Center, TriStar Northcrest Medical Center in Springfield, and Sumner Regional Medical Center in Gallatin. I've had a lot of fun at all these sites, and I'm here today to present some information to you, including my high school career, some pros and cons of it, some challenges I've faced, some things I've learned through those challenges. The clinical internship opportunity, both the class and the employment aspect of it in these three sites that I've mentioned. The past year and semester, a lot has happened, and it's shaped my decision making and who I am today. And so I'm here to include some information on that, including what I want to study, how that has been influenced by the past year and semester. My essay topic that I've chosen that was also influenced by the past year and semester, and why I wrote about this topic, including time for questions at the end. So, where have I been? The roots of education are bitter, but the fruit is sweet, once said by Aristotle. So, some pros and cons that I've observed throughout my high school career. Some things I've really enjoyed. My elective courses, of course. These include my health science classes that I've taken. This is the pathway that I've known I've wanted to take for a long time. And high school really presented an opportunity to execute on that. Meeting my favorite teachers, including Miss Wheeler, Miss Coffey, and Miss Hudson. These are some of the most effective educators that I've met in my time in high school and middle school, and I've really enjoyed the way that they've taught me, the way that they've presented to me information, and all the help that they've given me throughout my course, as well as some lessons learned, and we'll get more into that in a little bit. Some cons: boring courses, of course, nobody likes those. Some stress, some anxiety have been presented to me, and unnecessary deadlines. All these things coming together, making courses unenjoyable. And I find that a course is most effective when it is enjoyable to me. Now, going back to that bittersweet aspect of it, many elements of high school were to my liking, but many were not. There were plenty of ups and downs and many things that I've learned. However, the most valuable lessons were not the classroom teachings. They were widely applicable life lessons that I experienced while experiencing my ups and downs. Going on, some things that I've learned are not every grade is the end of the world. That has been one of the biggest revelations that I've only had recently. I used to stress over every assignment and pull my hair out to feeling like an assignment wasn't perfect enough, or what if I don't get this in on time? How is this going to impact my grade? And shedding that shell of anxiety and stress has been a massive development, both for me as a student and as a human being. Some things are more important than grades. Spending time with family and friends, to me, takes precedence over grades sometimes. And I think that your physical and your mental health are more important than your grades. And I think that should be reflected in the way that you study and the way that you treat your grades. Because if you put your grades ahead of your physical and your mental health, it will at some point burst through in the form of various different things, and one of these biggest things include burnout. And I've experienced burnout in the past few years, and it has not been an enjoyable experience, and it's been a damper on my educational experience and what I'm able to get out of it. Some of the most effective classes I've taken, and we'll run through these. Intro to Health Science. So that was with Miss Hudson freshman year, and that was one of the most enjoyable classes I've taken. I really enjoy Miss Hudson's style of teaching. She's fun, and she presents material in a fun yet effective way, and I can really appreciate that about a teacher. Intro to Health Science presented me with a lot of the introductory knowledge I needed to go on through the health science courses at Beach High School, and it really set the foundation for my health science learnings there. Diagnostic Medicine was another Miss Hudson course. Again, I really enjoyed her teaching style. Unfortunately, it was cut short by the COVID pandemic. And we'll get more into that challenge in a little bit. But the diagnostic sciences The diagnostic medicine course really presented me with information that built upon the Intro to Health Science course, and it was a fun learning experience to me. It really set me on the path towards diagnostic medicine versus medical therapeutics, and nursing. I found that I wanted to be more of a diagnostic professional rather than a nurse, and that was one of the biggest revelations I had, because I knew that I wanted to go into medicine, but diagnostic medicine helped me set myself on the course for what I specifically wanted to study. Honors Spanish 3 and 4 were a couple of courses that I took with Ms. Champion at Beach High School. She was an excellent teacher, presented material in very fun ways, but I knew I wanted to pick up a language because I think that being bilingual is an excellent asset to have in the medical field, and that's a goal that I plan to continue to build upon throughout my post-secondary education, is continuing to pick up fluency in Spanish. Going on AP English Language and Composition, that was taught by Ms. Hall, and it was an enjoyable course. It taught me a lot about rhetoric and how you can speak to people in effective ways, and I think that's another asset that most people need, that all people need when approaching the medical field, because you need things like bedside manner, you need soft skills, you need to know how to speak to people in an effective yet compassionate way, and AP English Lang really helped me own my skills in that area. AP US History was one that was taught by Ms. Dickinson, another one of my favorite teachers, and it taught me both a love for history but also a love for cause and effect, and finding themes and ways to relate information from different subjects. And it was a really enjoyable course, but it also taught me a lot about myself, mainly that need to find a cause and effect. Learning about things that happened in the 1800s that led to things in the 1900s that led to things in how we perceive information today in a political and historical element. These are things that are directly cause and effect related, and I think that can also be applied to the medical field in finding out how to diagnose and treat different patients. Honors Anatomy and Physiology was taught by Ms. Coffey, another one of my favorite teachers. Ms. Coffey relayed information very effectively, and I am very, very pleased with the amount of information that I picked up and retained from Honors Anatomy and Physiology. That really, it took the information that was set by Ms. Hudson in the first two introductory courses, Intro to Health Science and Diagnostic Medicine, and it really built upon it. You learned all about the human body, the anatomy of it, and how it functions in the physiological elements. Dual enrollment psychology was another great course for me. That was one where I really was able to execute on my love of psychology and my want to learn about the brain and neurology. And we'll talk more about that and how that has affected my decision making for my future. Honors Cardiovascular Services was actually the class taken just prior to clinical internship. And that was a hugely effective course for me in learning how to perform EKGs and learning especially the anatomy of the heart muscles, how they contract, the electrical signals that are pumped through them, the blood that's pumped through them, all these different things, all these key pieces of information that you need to understand how an EKG works, really set me forward on my path into my clinical internship experience. And now, finally ending with clinical internship, we'll go into that a bit more, but it's been probably the most profound experience I've had in my high school years. So, my clinical internship experience, both with the employment aspect, but also with the class. What is clinical internship? So, clinical internship is a capstone course that is intended to give senior students a taste of the medical professional world for the first time. We train in BLS, basic life skills, under the American Red Cross. We trained in OSHA skills using the OSHA 10 program. We trained under the American Red Cross, or the American Heart Association, I should say, in CPR, cardiopulmonary resuscitation, and under the American Heart Association in first aid, certifications that were necessary to pick up prior to the internship experience in the employment. Now, what is included? The key pieces of this capstone course include the internship opportunity itself, a research paper that we have typed up and presented to teachers, and a portfolio that we've put together, a professional portfolio in the form of a Google site that we have put together, as well as a presentation, the one I'm giving right now. So some hospitals I visited include TriStar Hendersonville, as I mentioned, TriStar Northcrest, and Sumner Regional Medical Center. All beautiful facilities, all with their own pros and cons. Hendersonville I really enjoyed because it is just about 10 minutes from my house, just to drive down the road. It was very easy to get to. I enjoyed the cath lab there. Usually when I was at TriStar Hendersonville, we would either be in the reading room or the cath lab. And I observed a lot of procedures there, a lot of procedures on eliminating peripheral artery disease and things that really affected people's quality of life, and that was something that was a really profound experience to me. TriStar Northcrest was, a bit of a challenge. It was 45 minutes from my house, and it taught me a lot about myself and the commute. Mainly that I enjoyed Northcrest, and so I was able to make that commute and be happy about it. I had no problem with it. TriStar Northcrest was where I performed a lot of, actually most of my EKGs in training, as well as the crew there was probably my favorite crew. They were all very hospitable and friendly to me, and that was something that made the experience a whole lot more enjoyable.
Where's Northcrest located?
Northcrest is an area, so TriStar Northcrest is in Springfield, but Northcrest is just a neighborhood in Springfield, about 45 minutes, 35 to 45 from Hendersonville. You can hence see why the commute was such a big deal. But going on, Sumner Regional Medical Center was actually in Gallatin. It was about a 20 to 25 minute drive each day, so not as bad of a commute. But we spent most of the time in the clinic there. Similar with TriStar Northcrest, we spent most of our time in the clinic and seeing patients, and we'll talk a little bit more about that and the duties that I performed there. Going on. So what was the internship about? It was an opportunity presented with us. I shadowed Dr. Gary Yawn, an interventional cardiologist with Tennessee Heart and Vascular, a private practice operating out of several hospitals in the Middle Tennessee area. I learned many things from him, both about the cardiovascular system and about working in a hospital setting. So what did I do? Going back to Hendersonville, Northcrest, and Sumner Regional Medical Center, there were three primary environments that I got to immerse myself in. The clinic, which included, my duties included guiding patients through the clinic, helping them navigate the checkout area and things like that, as well as performing EKGs in training for my certification that I'm yet to test for. The reading room, this is where I actually got to sit with Dr. Yawn and learn to read many different forms of imaging, including MRIs, CT scans, calcium scores, all these different things, and getting to sit down with him and learn about how to read these in a way that has not ever been presented to me before. These are things that are completely fresh and new to me, and he would point out a chart and say, okay, so you see this indicates higher calcium levels than we want to see. This patient has a lot of nodules in their lungs, as indicated by the white blobs in the imaging. Things like that made sense to me, but was completely fresh and new information to me. It was really enjoyable, and we not only talked about the imaging, but we talked about many other things. We talked about how to manage medical school and how to manage a work-life balance, both in medical school but also in the professional world. We talked about many, many things, and that was where I got to have some of my best and most personal conversations with Dr. Young. It was a very enjoyable environment for me.
How did you choose where you wanted to complete your service hours?
So I knew I wanted to do cardiology because of my family's tied to heart disease, but I actually wanted to do a neurology clinic, but no opportunities really sprang up. But cardiology was next up due to my family's ties to heart disease. I really wanted to learn more about that area of medicine. So my mom got me in touch with our family cardiologist, who happened to be Dr. Yon. And I had the practice manager send me over some paperwork, and we were set.
Excellent. So, what you mentioned a couple of things, non-technical skills that you picked up from Dr. Yon. Can you elaborate a little bit on other non-technical things that Dr. Yon provided you with, just in how he operates on a daily basis that you'll carry forward with you?
Yeah, absolutely. One of the biggest things that we talked about was work-life balance, and he taught me that you have to be able to separate your work from your play. And he said, Dr. Yon said, personally, I like to hunt and I like to game. Having different things at home that you're able to use to take your mind off your work, separating those is very, very key in preventing burnout and things like that. That was one of the biggest things we talked about. Going into medical school, not biting off more than you can chew. That was another thing that we talked about. And he really harped on that because, burnout is a very real thing. And if you become burnt out in medical school, you'll never make it in your true career.
How would you describe Dr. Yon's bedside manner with patients, and what will you carry forward with that?
His bedside manner was very effective. I would say effective is the best way to put it. He's a very kind and compassionate guy, but when talking to him, he cuts straight to the point. He's not one to sugarcoat. One of the experiences that we had on a daily basis was dealing with people that smoke and are frequent tobacco users. And one thing that he passed down to me is, you never want to argue with a patient. He says, because you find that once you argue with a patient, they never come back. And they seek treatment in other places, and that's not the goal of being a medical professional. It's just passing work to other people. But that experience with talking with frequent tobacco users who are affecting their bodies in such a way that keeps them coming to these cardiovascular clinics, he never fussed. He never got angry. He never raised his voice. But he always presented the information to them in a way that allowed them to make their own decision. And I think that's the most valuable thing that you can do as a medical professional to a patient, is education.
And that's where the whole communication comes in, right?
Absolutely.
Yeah.
All the soft skills that you can have, and the things that we talked about with my AP Lang class, your rhetoric and how you talk to people. That's one of the most important things that I've learned and picked up from the internship opportunity. Going back to some of the duties that I performed, the cath lab, especially at TriStar Hendersonville and TriStar Northcrest, it was a really, really interesting environment. Very cold, very sterile, and for good reason. But the cath lab was very interesting. Like I said, I got to watch a lot of peripheral artery procedures in their legs. People that come in with leg pain that are so sore that they can't move due to blockages in their legs. These are things that we're eliminating, and it really, really increases one's quality of life. And that was one of the most profound experiences that I had in my opportunity. So I got to spectate different catheterization procedures, and that was my primary duty, was spectation in that environment. So my favorites and least favorite parts of internship. Getting to meet and spend time with Dr. Yon was easily one of my favorite parts of the internship. Spending time with him in the reading room, being able to have personal conversations with him and develop an actual, somewhat of a mentorship with him was one of the most valuable things that I could have picked up from the internship opportunity. Spending time in a professional medical setting was something that I learned I really enjoyed, and is something that I can immerse myself with going forward. Learning to read imaging was another, like I said, a really enjoyable experience to me, because you're getting to see what a cardiologist is actually doing on a day-to-day basis and how they diagnose patients, and it was very interesting and very fresh new information to me. Watching procedure in the cath lab, like I said, was a very profound experience and very interesting. As close as you can get to, spectating the increase in quality of life for these patients, it was something that really blew my mind and was something that I really enjoyed.
That's one thing that I wanted to ask you about is, you can sit in a classroom and you can learn about all these different conditions and read heartbeats and signatures and things like that. When this starts getting in a clinical setting tied to real people, how did that change your opinion and your outlook in wanting to go into this field?
Well, I would say it changed it for the better. It set my eyes even further on the course of how can I move in a way that motivates me to get me there? How can I get to this setting as quick as possible? Because that was, speaking with patients and then seeing them in the operating room, it's something that you develop a compassion for and a real care for, and it all becomes real when you see somebody, under the lights. You see them getting ready to be operated on, and it's just a very visceral and very real experience that you don't really get in a classroom. Some of my least favorite parts of the internship included the commute, and slow days in the office, but these really paled in comparison to all of my favorite parts. If I had to choose, these were challenges, but easily surpassed because of the level of what I was doing. Now, moving on to another element of the clinical internship capstone course, my research paper. So what is the paper about? It's a 10 to 15 page research paper about an independent research topic of our choosing, and my topic was the biochemical effects of mental illness on the human brain, and we'll get more into why I studied that in a little bit. Another element of the capstone course is the portfolio. It is a Google site that we've put together this past semester, including all paperwork, as well as resumes and brag sheets, other professional pieces of information and documents required for the course, as well as assignments for the course that we've accumulated. And it was interesting to put that together because it was intended to be used as a professional portfolio, and I've never had to put together an amount of information like that to present myself in a professional light before. And that was an opportunity that I really enjoyed and really got to, relish in the internship opportunity, in the capstone course, that is. So the past year and semester. Challenging is one word that I can use to sum up the past year. I've learned invaluable lessons throughout this time, but they did not come without their challenges. School this past year has stretched me beyond any point that I reached before. My schedule was full of honors and AP classes, which was a stress and stretch, both academically, and at the same time, I was applying to colleges and for scholarships. It made for very, very stressful and challenging times. I've worked harder this past year than ever before, and I've also been more stressed this year than ever before. And with this, some challenges carried over into my personal life. Going on with that, in the past year, I've battled varying levels of depression and anxiety. This led me to lose a lot of weight and let my physical health diminish. After some time with this, I saw a psychiatric specialist who told me that I was likely suffering from a form of bipolar disorder. With this, and being interested in the brain and the subject of mental health for a long time, this was the experience that cemented my future path. Now, what is that future path? I actually plan on going to Tennessee Technological University to double major in cellular and molecular biology, as well as biochemistry, on my way to becoming a neuropsychiatrist. I intend to use my EKG certification in order to make money while I study at Tech. And this will make it possible to begin paying off student loans and live decently, allowing me to prioritize my studies. Now, what did I write about? Going back to this, I wrote about, in my paper, the brain's biochemical structure and the changes that are made by the presence of mental illness. Some points that I hit on in that paper were the brain's normal structure and how this is affected and treated in cases of depression, anxiety, bipolar disorder, and ADHD. These are actually disorders that I included in the paper because they're very prominent mental disorders in today's world, but also things that were discussed in relevance to me. These are things that doctors have discussed. And within my context of my situation, I've seen, depression and anxiety battled by, not just me, but my friends and my family members, as well as ADHD. It's very prevalent in my family. These are things that have had a profound impact on me, as well as my own diagnosis of bipolar disorder. And so that's why I chose these specific disorders to study and to really hone in on my paper. Going back to why I wrote about it, I've been really interested in the brain and its response to mental illness for a long time. And like I said, I've had my own personal experiences with it. Thank you so much for your time. What questions can I answer for you?
Yeah, so what would you say is your greatest disappointment in high school?
I would say that the COVID-19 pandemic put a massive damper on my school experience and put a strain on my academics. Like I said, it put an end to a lot of courses that I really enjoyed. And that was probably one of my biggest disappointments in high school, was ending things like the diagnostic medicine course that I really enjoyed with Ms. Hudson. Other than that, though, through this experience, I learned a bit about my own resilience and my determination to succeed in tough and surprising circumstances. And so that presented with it along with it an opportunity to learn about myself, and I always enjoy and relish those.
So given everything that you've learned in the internship and everything you've learned about yourself and through high school, what motivates you to do your best on a job?
So I would say that the fact that we only get one chance in life is likely the biggest motivator to me. One of my biggest fears is having regrets, and especially if the regret is that I did not put forth enough effort or live in the moment. So, therefore I try to avoid that and put forth as much effort into my studies as I can, because I never want to live with that regret of knowing that I didn't try hard enough or I didn't live enough in the moment. That's, my biggest fear, I guess you could say, is my biggest motivator. And the fact that we only live once, I want to do everything as right as possible. As right by me and as right by those around me.
And do you find that work-life balance, or just having a balance in succeeding versus being sane at the same time, do you feel like you have a better balance at this point?
Absolutely. I think that's one thing the internship opportunity has really taught me, both in talking with Dr. Yan, but also with my experience throughout the course. At one point, for instance, I was working about 20 hours at Starbucks as a barista at the same time that I was working around 8 to 10 hours on my internship and working out that commute with getting home and rushing through a meal and then changing and getting onto work. Balancing that with school was very, very challenging. But it taught me a lot about myself, like I said, in my resilience and my determination to succeed through tough circumstances. But it also taught me, sometimes you need to take things off your plate. And you have to understand that we're not machines and we're not built to operate that way. And coming to grips with that and accepting that has been one of the biggest revelations I've had, and one of the biggest building blocks for growth for me in the past semester and the past year.
That's excellent. And time management plays a huge part in that, right?
Absolutely.
The things that have to stay on your plate.
Absolutely. You have to learn to manage what has to stay on your plate, and what you can push off, what you can put to the side, what you can wait till tomorrow to finish, things like that. These are time management and accepting that you can't do everything at once are things that I've really worked on this past semester, and skills that I continue to want to build in the future.
Everybody has to have their own definition of success.
Absolutely.
What success means to you. So what does it mean to you?
So success to me means setting yourself up for happiness in the future while having fun in the current moment. Going back to what you said with, being successful while staying sane. That's the biggest thing that I can mention as far as success goes. I do consider my high school career successful, as I've satisfied both of these criteria. I've enjoyed my high school experience while earning professional certifications, and setting myself up for success in post-secondary education and in the professional world as well. My future measure for success will change, but I imagine it'll stay the same as far as I have to emphasize again, having fun now while setting yourself up for fun later. If I'm smiling and laughing now while doing things that, care for myself and the people around me, things that I can execute on with my compassion in the medical world, as well as, setting myself up for future smiles and laughs. That's my definition of success.
I like that. So what do you feel are your greatest strengths that you can provide to your patients?
So I believe that my drive to succeed and my compassion are my two biggest assets, especially as far as the medical field goes. It takes a lot of determination to make it through medical school, and even further, it takes a lot of compassion to make it work in the medical field and be successful, because you have to care for each patient and be considerate of their needs. That was one thing I learned from Dr. Yan, is his bedside manner. Being able to present information in a non-argumentative way, that was something that I found really valuable and something that I picked up from him, and I will, continue to push forward with as I go throughout my own career. That the intersection of, determination to help people and compassion. Those are, two of my biggest assets going into the field, but two things that I want to continue to build on and hone and sharpen as I go further.
All right, well, thank you so much.
Of course, thank you for your time.